Let me ask you something. When we talk about healthcare for seniors, what do we usually think about? I mean, I think about it. I talk about it all the time. Talk about falls, medications, hospitalizations, dementia care, physical needs, feeding, mobility, all that stuff. But what we don't talk about enough, especially in senior care, is mental health. And I think the truth is, I really do think we're in the middle of a silent crisis because seniors are suffering quietly. I know this. They're not marching in the streets, they're not posting about it online, creating awareness, and they're not, especially not telling their families. I think they're just living with it. And I do think that the numbers tell a powerful story when you research into it. I mean, nearly 1 in 3 older adults report a lack of companionship. About 30% of adults over 50 say they feel socially isolated, and over half of seniors experience loneliness at some point in aging. And here's what's even more alarming: social isolation isn't just emotional, it's medical. We know this. It increases the risk of premature death by nearly 30%. So really think about that. Loneliness can be as dangerous as many chronic diseases we spend billions trying to treat. And yet, because it's quiet, we don't treat it with the same urgency. Why? I really think part of it is generational. I mean, if you think back to the 80s and 90s when I grew up, we didn't really talk about mental health either. Depression, anxiety, therapy. Those conversations, quite frankly, were stigmatized. They're hidden. And it's really, I feel, only in the last 10 or 15 years that mental health has come into the mainstream. But for seniors, they were raised in a time where you didn't talk about feelings. You pushed through. You kept it to yourself. So guess what? Now we have an entire generation that is struggling. They're not talking, they're not speaking, and the system doesn't always catch it. Depression in older adults is missed, I believe when I research, up to 50% of the time in primary care. Only about 1 in 4 seniors with mental health condition receive specialized support. So even when they show up, we still miss it. Now, layer in what aging actually looks like today, especially for many families. I mean, families that we even serve locally here in Long Beach or Lakewood or Downey or Los Angeles County. I mean, it's the loss of a spouse, friends passing away, kids moving out or moving away, they're driving less, mobility challenges. I've had patients tell me they're just waiting to die. The world gets smaller for them. And over time, that shrinking world becomes isolation. Today, one in about 4 seniors feel isolated, right? They have depression. Nearly 2 million Americans over 65 suffer from it, depression. But it doesn't always look like sadness. Sometimes I know it looks like sleeping more, eating less, not wanting to go out, missing appointments, or frankly, just losing interest in life. And I really do think we dismiss it as, oh, it's just aging. That's it. There's another layer to it we're not talking about enough. Coping. Some older adults turn to alcohol or substance abuse to manage sleep, stress, or emotional pain. And I think that trend is growing, which tells us something important. This isn't just about a health issue, it's a human connection issue. So why does this matter so much? Especially for those that there are services out there, whether it's a senior center or you go to a WellBe Health or something similar, there's community, right? We just don't see the full picture. I mean, even what we offer in home care, companion care, dementia care, we're inside these environments right now and we see it. The untouched meals, the quiet homes, someone just sitting there all day, watching TV, but really not watching, change in mood, a withdrawal in life. We see it. We see others that don't because they're at home. These seniors are at home. And I really think this is one of the most treatable challenges in senior care. Connection works. Purpose works. Having a routine works. Companionship care. I get it. Some people don't want to pay for it or they're like, why? They're just here talking to them. but it's healthcare. Seniors who stay socially engaged have a significantly less lower rate of depression and better overall health outcomes. Okay? So it's about raising awareness. I mean, I think I was just thinking about it. That's why I created this video real quick. It's raising awareness. And if you're an adult child and you haven't seen your parents in 6 months, give them a holler. Call them once a week. Are you okay? And actually listen to that. Okay? Because we don't talk about this enough. It just stays invisible. Stays invisible. It doesn't get treated. And I get it. Some of the older parents, your elderly parents, don't want to talk about it. I understand. But I just think we have to do better. We have to see our seniors, not just their physical needs, but their emotional well-being, their loneliness, their identity, their purpose. Because at the end of the day, no one should be aging in silence. And I think no one should feel alone. Anyhow, as always, if you enjoyed this video, please like, subscribe. Just a hot topic I wanted to talk about in my mind. Thanks.